You mentioned so many different services that you guys offer. How many people are you guys seeing on a yearly basis? I know 2025 just ended. Did you have a about estimate of how many people were served?
230,000 individuals. So that's not for visits. We have over a million visits because often they come, from multiple appointments. There's
Yeah.
obviously different needs, but in terms of like unduplicated individuals, it's over 230,000.
That's a lot. You guys are doing
It's
a
a
lot
lot.
of yeah, yeah, yeah. And you just mentioned we're barely tapping the surface because there's
hmm
still so much opportunity to be quite frank. And how do you get there? Can imagine there's a lot of creative control, a lot of creative ideas that come with that. And how do we continue to reach the masses, right? Where
Absolutely. Well, and one example would be our street medicine team. We literally have providers who, in keds and scrubs, and a hoodie or a rain jacket, depending on the
wow,
weather, because it doesn't rain a lot in San Diego, but it can be drizzly. It can be drizzly. But, rain or shine, they're out with a case manager, potentially a health navigator, a substance abuse counselor, is on call, and they are walking through encampments to say, what do you need? Can we help you with
wow,
your medication? We'll help with transportation. We'll take them to a clinic. We'll get their meds refilled. We'll make sure that because now the requirements for Medi-Cal and Medicare are going, they're more stringent. Now you have to renew twice a year. So there's people who qualify who might not renew because they don't have they don't get the information or they don't have a good address for where they're getting their
yeah.
paperwork to renew, and so we're out there helping them renew. We're out there making sure that they can still access their benefits, and keep their meds. And one of the things that team does is partner with SDPD because they have a homeless outreach team. It's called HOT for the acronym.
Yep.
They work with the HOT team, so that because basically what we were seeing was we would be, our street medicine team would be in these encampments, and there might be an infection, a disease, an illness going around, and we've got it close to being controlled. We're going twice a week to these encampments. We're making sure everybody's on their meds. We've got it sort of close to being under control, and then for legitimate reasons they have a job to do, but businesses complain, they're blocking entrances, so they'll come and do a sweep of the encampment, which means you've now
Mm,
scattered all of these individuals with something that's
yeah.
infectious and thrown away their meds. Because basically they come in and sweep everything and everything gets tossed. And
Yeah.
now it's a public health issue. And so our team basically reached out to them and said, we're not trying to stop you from doing your job, but can you give us a heads up before you do this? Because we can go in and we can talk to them about how do we find you? How do you find us? Where's a clinic you could come in if you wanted to? Where is your kind of backup plan? Can we connect you with, the homeless task force, the regional task force on homelessness for, to get a bed somewhere or path to get a bed somewhere? There's a lot of organizations that do great work in San Diego, and we can kind of help try to create some stability in infectious diseases. And we found SDPD to be very, very willing to work with us. And so now they give us a
That's
heads
good.
up and we'll go
Yeah.
in, with these other partners and try to get people in beds or try to get, make sure that they have their meds, make sure that they know where to come find us to get refills on the meds if they do get thrown away. So that's just one of those really innovative. I like the street medicine team as an example of innovation and really understanding the community, as well as our mobile mammography unit.
Well,
You know,
what is your day to day? I mean, there's so many different pieces going on. What does your day to day look like?
there's no 2 days that are alike. It's one of the reasons I love my work. Sometimes it's going to a networking event and talking to kind of the movers and shakers, of San Diego and telling the stories. Sometimes it's sitting down with an individual or funding, a philanthropic organization and talking through what a gift opportunity or a proposal might look like. Sometimes it's partnering, last week I went with one of our therapists for our concentrated mental health program, which is a really special high needs program. And we went and sat and got a tour at a local farm that basically produces, I would misquote it if I tried to say how much vegetables, but they produce a ton of fresh vegetables, and their mission is to basically feed people who can't, afford it.
Wow.
And so they have farmers markets where they basically like you pay what you can. It's incredible, but what we wanted to know is can we partner and create maybe
Yeah.
some joint proposals or collaborations so that our folks in the concentrated mental health program can get some fresh produce, because a lot of them qualify for SNAP or EBT benefits. They can go to a food pantry, but they really struggle to get fresh produce.
Yeah.
A lot of them don't drive. And there's not places walkable in their communities where they can afford healthier foods.
Okay, I got a question for you actually. Now that I think about what you just mentioned, the mental health. Do you think that for those that are watching, what we eat changes the mind or helps with the mind,
I
right? So
think
when you talk
food is
about
medicine.
fresh produce, and I say that because I have a friend. He distills his own water, right? He
Hmm.
doesn't drink out of a bottle, and his saying is like, "Hey, when I gave up drinking bottled water or faucet water, my health changed tremendously." Now, this is also someone that experienced 10 years of addiction. And he
Hmm.
just meant, and so he always makes fun of us. He's like, I'll never not shop at Whole Foods because Walmart is low quality. So I go to Walmart, by the way. So whoever's
Sure.
watching, Walmart's okay. But I think his mindset may be there because of his past. Is like, I want to get the best in me so I can get the best out of me. You
Absolutely. I
agree?
mean, I believe food is medicine. I have garden beds. My wife and I are growing our own vegetables.
Love it.
I want to know things don't have chemicals and pesticides. I mean, I will say I am not one of the people who has any issue with genetically modified foods.
Hmm.
I actually think it's the way that, because I've been on the science side of it,
Hmm.
I think how we partner science with agriculture is the only way that we're staying ahead of climate change, because we're producing vegetables that have higher resistance to, we're we're seeing increased salt in our water, so higher salinity
Hmm.
in our rain. We're now producing vegetables that can withstand that. We're now producing vegetables that can withstand, greater temperatures of heat, longer periods of drought. So I don't have an issue with GMOs. I have an issue with chemicals. I'm not going to put chemicals in my body. I don't want pesticides. I think the research on what things are worth buying organic is really interesting. It doesn't always have to be everything, but the things that are like root vegetables, they're going to soak up more of those chemicals in the dirt, and so they're really worth splurging. I am not a Whole Foods for everything kind of person, but I definitely am a you get your best nutrition not from supplements but from your food.
Got it. Okay.
Drinking a
I don't know.
green drink isn't going to cut it. Eat a broccoli.